Now, the patient can actually present to you with a couple of complications. So one complications I have been repeating again and again is Ileitis. And, sometimes it happens that the patient has unexpected or unsuspected Ileitis, and the patient actually report to you with the right iliac fossa pain and fever and a tenderness, and you probably diagnose it as acute appendicitis. And then when you mark the incision and you made the incision and you try to open up for acute appendicitis, and you are suspecting and you are planning to do the appendectomy, but you are encountered with the unsuspected Ileitis, or it may be possible there is a formation of a mass and you suspect that there's a appendicular mass, or you cannot differentiate between ileal mass or appendicular mass. Then you have to go for the ileal resections. So you can see here that the normal anatomy of the small intestine should be very clear in your mind. Okay, so we know that this is the mesenteric border, and this is the antimesenteric border, and you know that this is the cecum, and the base of the appendix is attached to the cecum. And here, the ileum is actually, this is the terminal ileum, which is connected to the cecum. So you have to think about, because obviously the terminal ileum is in the right iliac fossa and it's attached to the cecum, and the patient can actually present to you with a right iliac fossa pain. And if you are encountered with such a scenario that you're suspecting acute appendicitis and that came out to be ileitis, or there's ileal mass, then you have to go for the ileal resections. And then see, for example, like that was the part, okay, so that was the posteriorly there was attachment of the ileum, and then there was this appendix as well, which was dilated. Now, but in case of the Ileitis, you just have to do the ileal resection, and then you have to do the primary anastomosis with the ascending colon, or you have to do the anastomosis with the transverse colon, if you do the ileocecal resection along with the ileal resection. But if you're only doing the ileal resection, then you have to do the remaining portion, or the proximal portion of the, usually you remove the terminal or distal ileum. So the remaining portion, especially the proximal part, is primarily anastomosed with the cecum, and it's like you can do end-to-end anastomosis, or you can, it's probably anti-side anastomosis in case of the ileal resection. Either you do the anti-side anastomosis, or you do that's a submucosal, single layer extramucosal, or you can do the double layer or multiple layer anastomosis, depend upon you, but you do the anti-side anastomosis in case of the ileal resection. Now, in other confusion, in case of the unsuspected ileitis, if you have to do the appendectomy or not. So the guidelines say that if appendix is not acutely inflamed, then there are chances, in case of the Crohn disease, there are chances of the formation of multiple fistulas. And in case of the fistulas, what you have to do is, like, the patient will again report to you with the same complaints, and then you have to do a proper repair and resection and anastomosis and fistula repair. But if you do the appendectomy, the chances of the fistula would be more. So if there is ileitis, but there is no appendicitis, then there is no indication that you do the appendectomy. Just do the ileal resection, do the primary anastomosis, and close in the reverse order. So, but if there is acutely inflamed appendicitis, because sometimes if there is ileal inflammation and there is unsuspected ileitis, so secondarily to the ileal inflammation, there is a possibility that appendix is also inflamed. But if there is no, you decided intraoperatively, okay, so you open up the patient for appendicitis, but that came out to be unsuspected Ileitis, and the question is whether you do the appendectomy or not. So if there is acutely inflamed appendix, go for appendectomy. But if there's a normal appendix, then you don't have to do the appendectomy. Just do the ileal resection and do the primary anastomosis, anti-side anastomosis with the proximal end of the ileum with a cecum.